Canagliflozin is a sodium glucose cotransporter 2, SGLT2, inhibitor used to manage hyperglycemia in type 2 diabetes mellitus, DM. Also used to reduce the risk of major cardiovascular events in patients with established cardiovascular disease and type 2 DM. In this video, let's found. What is canagliflozin? What is canagliflozin used for? Contraindication. What are the side effects of taking canagliflozin? How does canagliflozin work? How to use canagliflozin? What is canagliflozin? Canagliflozin, sold under the brand name Invokana among others, is a medication used to treat type 2 diabetes. It is used together with exercise and diet. It is not recommended in type 1 diabetes. It is taken by mouth. Canagliflozin was approved for medical use in the United States, in the European Union, and in Australia in 2013. It is on the World Health Organization's list of essential medicines. In 2020, it was the 294th most commonly prescribed medication in the United States, with more than 1 million prescriptions. What is canagliflozin used for? This drug is used in conjunction with diet and exercise to increase glycemic control in adults diagnosed with type 2 diabetes mellitus. Another indication for canagliflozin is the prevention of major cardiovascular events, myocardial infarction, stroke, or death due to a cardiovascular cause, in patients with type 2 diabetes, as well as hospitalization for heart failure in patients with type 2 diabetes. In addition to the above, canagliflozin can be used to lower the risk of end-stage kidney disease and major increases in serum creatinine and cardiovascular death for patients with a combination of type 2 diabetes mellitus, diabetic nephropathy, and albuminuria. Contraindication. Canagliflozin is contraindicated in type 1 diabetes, diabetic ketoacidosis, severe renal impairment, estimated glomerular filtration rate less than 30 ml/min/1.73 m2, end-stage renal disease. Patients on dialysis. Side effects. More common: bladder pain, bloating, bloody or cloudy urine, decreased frequency or amount of urine, difficult, burning, or painful urination, discharge with a strong odor from the penis, frequent urge to urinate, increased thirst. Pharmacodynamic. This drug increases urinary glucose excretion and decreases the renal threshold for glucose, RTG, in a dose-dependent manner. The renal threshold is defined as the lowest level of blood glucose associated with the appearance of detectable glucose in the urine. The end result of canagliflozin administration is increased urinary excretion of glucose and less renal absorption of glucose, decreasing glucose concentration in the blood and improving glycemic control. A note on type 2 diabetes and cardiovascular disease. The risk of cardiovascular events in diabetes type 2 is increased due to the damaging effects of diabetes on blood vessels and nerves in the cardiovascular system. In particular, there is a tendency for hyperglycemia to create proatherogenic, plaque-forming lesions in blood vessels, leading to various fatal and non-fatal events, including stroke and myocardial infarction. Long-term glycemic control has been proven to be effective in the prevention of cardiovascular events such as myocardial infarction and stroke in patients with type 2 diabetes. Mechanism of action. The sodium glucose cotransporter 2, SGLT2, is found in the proximal tubules of the kidney, and reabsorbs filtered glucose from the renal tubular lumen. Canagliflozin inhibits the SGLT2 cotransporter. This inhibition leads to lower reabsorption of filtered glucose into the body and decreases the renal threshold for glucose, RTG, leading to increased glucose excretion in the urine. Half-life. In a clinical study, the terminal half-life of canagliflozin was 10.6 hours for the 100 mg dose and 13.1 hours for the 300 mg dose. Dose. Type 2 diabetes mellitus. Initial, 100 mg POQ taken before the first meal of the day. May increase dose to 300 mg q.day if 100 mg per day tolerated in patients who have eGFR greater than or equal to 60 ml/min/1.73 m superscript 2 and require additional glycemic control. Indications: indicated as an adjunct to diet and exercise to improve glycemic control in type 2 diabetes mellitus, T2DM. Also indicated to reduce risk of major adverse cardiovascular events, cardiovascular death, non-fatal MI and stroke, in adults with T2DM and established cardiovascular disease. Indicated to reduce the risk of end-stage kidney disease, ESKD, doubling of serum creatinine, cardiovascular, CV, death, and hospitalization for heart failure in adults with T2DM and diabetic nephropathy with albuminuria 300 mg/day. Safety advice: there are no adequate and well-controlled studies in pregnant women. AUTGA pregnancy category C drugs which, owing to their pharmacological effects, have caused or may be suspected of causing harmful effects on the human fetus or neonate without causing malformations. That's all the information about canagliflozin we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.